Good morning everybody. Today we are going to talk on the PFN-A2. The PFN-A2 is somehow different from that of the existing conventional PFN, but basic principles remain same. So we are going to talk about the various instruments, the techniques, and how step by step we need to go for the fixation. So today's class is basically this. So basic things are basic. That one thing I have already mentioned, that we must have a good reduction of the fracture. That should be confirmed with the yarn. Then doing the reduction. After reduction, you may need to do some sort of a mini exposure also, sometimes to leverage and other thing. That's under that. Then after that, one can go for temporary fixation of this here by see. I am putting a caver just beneath the anterior cortex of the right. So another caver you can put to just beneath your posterior cortex. But you must have enough space to work, enough space so that you can negotiate with the instruments and other things like that. Implants, so that it should not come in between. The next thing is to what? Next thing is to you go for what? You go for the entry point and also guide here. So here entry point is in tip of the token. As you know, it is off axis, not on axis. There is angulation here. This is off axis intermediate device. So you have to be on the tip of the trochanter 1. Number 2, it should be also confirm the lateral view that I am in the center, in the axis of the middle cavity. That is must. That is one. These sort of owls are better because you have a hole over there through which you can pass the. You may find something difficult. You can pass the guide wire through it. So this is helpful because one step you can make it more simpler and smooth. Because sometime after making the hole, you may find it very difficult to push the guide wire here. Here guide wire is like this. You are pushing guide wire like this. This job is done. Next what? Next what is your better to put a guide wire sleeve like this. This guide wire sleeve will necessarily protect the soft tissue. So it is important because while doing the proximal reaming, this reamer is very important. This is a type of reamer. Yes, sir. This is basically to accommodate this part of this nail. So we must make a big hole. But while doing so, all the muscles are around. So that while I am putting it may entrap the muscle also. So to avoid this, better to put it like this. Then through which you can pass the proximal reaming system inside and do the reaming job. Hold it. Yes. You go up to this level. There is a stopcock. So after going to some extent, it will not allow you to go. This is being designed like this. So you cannot go beyond the limit. So it will prevent you going. This job is done. Okay, I am removing this. Now what about the distal part? Distal part you can go for the distal reamer or you can go for flexible reamer for the distal part. This will help you to know what is the size of the nail you are going to use. You know this part is fixed, this part is variable. So this is again coming with 9, 10, 11, 12 like this depending upon the size of the middle cavity. So that is this distal part, this part should be reamed with the help of your flexible reamer or something like that. So you can pass it like this, ream it. You will know what is the size you are going to do. If it is 11, then you have to go for 10. If it is 10, then you have to go for 9. That's principles are even same. So after doing this, what next? What next you are going to do? You are going to select here. So how to put the nail, lock the nail? This is Allen key. So this is the nail coupling bolt, only like this. So this is a bolt which is coupling the nail with the device. So you are locking it like this. Fix it nicely. So PFN-A2 is being locked with the jig. So this is a PFN jig. So you can see the track also. You can see trace the track with the help of this. This is called lateral buttress. You can see the track. You can confirm it whether I am in the right track or not. You can confirm that I am in the right track or not with the help of your slip inside and see. One can see. You can confirm it that I am going this end. You can confirm it beforehand also. Sometimes some mismatch may be there. So to make it sure that it is going nicely. So what next? So necessarily you have to go for the nail inside. Now I am putting the nail inside. Go and go. Now a condition is coming that you need to hammer it. How to do it hammering? Hold it. How to do the hammering? You do not hammer over the device. Make it a habit. Even interlocking nailing system also, if you try to do so, 1 or 2 degree angulation will make your life miserable subsequently. Do not try to use the device which is meant for you. So that is a device which is going to help you to impact the nail further. So this is being locked like this and locked it like this. Right? Now you are going to hammer it inside if you need. If you are unable to push it comfortably, you need to do some sort of more hammering. Then use the device. Do not hammer on the device. This will make your life miserable later on, because 1 or 2 degree of angulation in this area will mistake. That will be more problematic in subsequent days. Clear? So do not go for the shortcut. Better to go for step by step and adhering to the principle. This principle is applicable not only here in tibia, femur, anywhere. You do not hammer it. This is a thing you need to learn. Somebody used to have a tendency to push it door, do the hammering. If you do so, 1 or 2 cases, okay, it will go. Subsequent cases, you will find there is a mistake and you are unable to go for the locking. So do not go for the shortcut. This is a device meant for the impaction. You are now inside the medullary cavity. Now you from the hole you can make out whether I am in the center, I am in the inferior part or the center. That judgment you can take for the trajectory through the hole. One can have an idea that whether I am there or not. So once you are there inside, supposing you hold it like this, now this is the position inside the medullary cavity. I am confirming it with the help of X-ray that I am supposed to be like this. The hole should be matching with that of your medullary. One can have an idea the obliquity is like this. If I am passing a pin, it should go center. Okay. Now what next? Next is that hold it like this. Now you are going to for the lateral buttress. So there is see this system is a bit different. There is a locking mechanism here also. Now you push it inside. Push it inside, it should go like this. Now, how much you have to go?
Till the touch the bone, sir.
Yes, it suppose that. So look at. So you keep it like this, and if I am going like this, it's supposed to hinge on the wall. Hold it like this. It's supposed to hinge like this, and after that, if you are tightening, see there is a locking mechanism here. You can lock it. It locked it. Now you unable to touching the lateral wall of the femur. Then what you are going to do? You are going to rotate it like this. Once you rotate it, is going up. One time will come that it will compacting here. This device is also indirectly help you to have a good reduction of fracture in a reversibility. You will find that if it is compressing, you will find the reduction is coming out. Now it is anchoring on the lateral wall of the cortex. This is very important. Once it is done, then what you are going to do, this is this slip. This slip is like this, it is going inside. What next? What next? What next? What next? Tell me, what next? No, I am going to use this device. Why it is important? So this hole is very central. So you need to have a tract on the lateral wall. If you are directly putting your guide wire, this guide wire 3.2 size inside, sometimes it may negotiate while you are hitting on the wall. It may go 1 or 2 degree anteriorly posterior like this. Then it will go inside. There is a deflection. Possibility of deflection. Are you getting my point? So if you are making a hole with this device in the lateral wall, so I will make a hole like this. See, it is a hole. See, now I have made a hole over there. Then necessarily while I am pushing the guide wire, it will go through the track. Otherwise, you can use this guide wire directly. Sometime 1 or 2 degree deflection may take place this way, that way. That will prevent the guide wire to be more central, bull's eye. No, it will be not there. So to make it more central, you are supposed to make a hole with this lateral perforator. So you can see that it is a lateral wall perforator. After that, I am going to push the guide wire through the perforator. Now it is the main device. Now how exactly we are doing? We are doing like this. I have already made a lateral wall perforation with the help of your hammer it. Hole is being made. Then I am withdrawing it. What next job? Next job is to go for this guide wire. Now guide wire is going like this. Guide wire is going. What is the size? 3.2. So it is going like this in the center. Okay. What next?
We'll have to just remove the
What next?
slip for guide wire and we'll have to add one.
Is it okay? No. I am not happy. I am happy with the AP view. But not, I am not sure 100% whether I am anterior or posterior lateral. What next then? I must have a lateral view.
Yes.
Lateral view. I must have a. Sometimes it may be like this. It may be like this. So necessarily in AP view we will be in center. So if it is going a bit inferiorly, okay, you can have to put the nail a bit up. If it is going down, then up. If it is up, again push. So at the time you will know, once you are going like this, from this point, you can have an idea that if my trajectory like this, so it will be central or it is superior or inferior. One can make out, yes or no. One can have an idea that I am going to perforate this anterior wall. Now this will give you the guide about the inferior and superior part. So your idea is to keep in center. One part is over. But what about the lateral view? You must take a lateral view. You see. So sometimes it may be going towards the more anterior part. Sometimes posterior part. Same thing applicable for your PFN-A2. Same thing. So it has to be central in both the AP view and lateral view. After confirmation of both AP and lateral view, what next? Then I am keeping this guide wire inside. I am removing this part. Down. What next? What next? What next? This. Is it? Okay, fine. Anything more than that? Very good. One thing, one should go for the lateral wall. So there is a device. This is mainly for the lateral wall perforation. So you had already made a hole. Guide wire is in, which is being confirmed with both AP and lateral view that I am in center. Now I am going to push the blade inside. Before that, one should put this here inside so that I could able to go inside and perforate the lateral wall and go. But it does not allow you to go further. This is limitation. Just stop device is there. So you do not go ever. So once you are going, it is locked, then this job is over. Now you have to remove this part. Remove this part, guide wire is inside. Now you are, now subsequent part is a bit crucial. Crucial in the sense that from the quality of bone, you can determine whether I am going to ream or not ream. It is said there is soft bone, very soft bone. Probably you may not need to go for reaming inside. But very hard bone, probably you need to go. So that you will be just by your own perceptions. That bone is very soft, very osteoporotic, may not need to go and make a track. Otherwise, you have to use this reamer. So I am going to put the reamer inside now, inside this area. Now how much you have to go? Same principle. You should not perforate the cortex, subcondylar bone, 10, 5, same principle. Yes sir? Essential. Now this part, whether I am going to do a full reaming or I am going to do half reaming or I not at all reaming. Sometimes you may not need to do a reaming also. This all depends upon you. But while you are doing the reaming, you are necessarily cutting lot of bone. So once it is job is over, then you have to. Now there is a step in between. What is the step? To measure the length. The measuring of the length is very interesting, that you can take the help of this device. Put it here, then you can make out there what is the length. You can make out this thing, how much it is there. From this you can make out that how much length I need to. One technique is this. Another technique is this, that you can take it directly, put this here with the help of your device and see. There are two techniques to measure the length. One technique is this, another technique is this.
So sometimes people also use another guide wire of the same size and just take the.
There is a subsection technique. So subsection technique from lateral wall, how much is lying behind. So if you can put the guide wire lateral and hitting it, then the part which is remaining outside you can subtract it, then you can make out. These are the techniques by which indirect technique, direct technique. This is a one technique, this is another direct technique. You know what is the size I am going to do, 85, 80, whatever it might be. Now this is what?
Blade.
Head blade. PFN blade. Basically it's called blade. So this concept is coming from your speech pattern, SP nailing sort of thing. So how to lock it and what is the technique here? Here's the interesting thing. So this is your blade. So, blade pushing device. Now there is a technique. See, one thing that if you do it like this, it will come. See what is happening to the gap?
Reducing.
It is. Now if I find it difficult to do it now. Now, is there any simple technique to do so? Yes, one more device is there, this thing. So, this device is going to make the hole like this. So, to have a very tight, so you have to do it like this. Are you getting my point? Look at the gap between these two. There is a compressive device. So, if I am doing this, it is, gap is there. Now, it is mobile. Now, if I am tightening it like this, it is going to cause the compression of this area. So, yes or no?
Yes, sir.
Yes. This is very interesting. So, it gives a compression of the area. Now, what I am going to do, see, if I am putting the device like this and do the outer left side lateral, it will lock it like this. Now, gap is there. This is free. This is time you have to go inside. I have already measured that I need 85 or 90. Now I have to put it like this. No. So it is going like this. Now a time will come, you are going inside. Now what next, what we are going to do? You do the hammering. With the help of a hammer, you have to hammer it here. So one time will go. Meanwhile, you also look for the X-ray. It should not penetrate out of this cortex. 1 point. Number 2, sometimes the guide wire may lock in between and may push the guide wire along with it. Sometimes go inside. It happens sometimes you may not have a freeness inside the guide wire. So while hammering along with this, guide wire may go migrate upward. So to prevent this, you should take shot in between. So one time will come that I am happy, I have achieved this target, and meanwhile you will find it will not allow you to go further. So it is stuck here. So your job is over. What next? Tighten, not tightening, reverse. But now you are tightening, then it will be compressing. Now at this point of time, 2 things one can do. One, release the traction. So traction release will help you to compress on the flexor side. 1 point. this fragment, this blade part is locked in the distal part. This is in the proximal part. So flexi is in between. So once I am doing it, I am rotating it like see the gap which is now reducing, and what you are reducing? Actually you are causing compression at the flexor side. Compression at the flexor side. Now I am doing like this, I am hammering, then I am tightening, one time will come, it will compress here, equally it will unlock this part also. The thread will be unlocked. So you can remove the device. Now your blade is being fixed. Reduction is being achieved. Now what you are going to do? So you have to see, unlock this, remove this part, lateral buttress way, you remove this part. Before that, I must have told you that the guide wire which you have put, you have to remove it beforehand. Yes, sir? Yes, that is a must. That is no. So you have removed the guide wire beforehand. Then I am already putting the blade inside. Compression also is being achieved. Now only part is remaining is the distal locking. Distal locking, two techniques. So you have to remove this device now. This device is basically proximal blade. So then you have to use it 170 usually. There are two holes. One hole is dynamic, another is your static. So you can apply whatever you feel like. So your sleeve is there. It will go like this. Then your trocar is there inside. So it will do for the sectors. So after that, what you are going to do? You are going to remove this thing. You will already do a distal locking system. Then you unlock it with the help of your T handle. Not T handle. This one. Yes, sir. So your job is over. Now, any question in this one?
Sir, hammering the blade.